Welcome to this explainer. Look, as the temperatures outside absolutely skyrocket, we all know exactly what happens here in Dubai. Everyone, and I mean everyone, heads straight to the pool. When it is just way too hot for a run or a heavy outdoor session, swimming is hands down the best way to beat the summer heat. But at Westminster Multispecialty Clinic, what we actually see with our patients is that this sudden shift to the pool might be causing hidden injuries. So today, as a medical educator representing our clinical team, I'm going to walk you through exactly why these injuries happen and, more importantly, how we fix them.
Let's kick things off with a phrase we hear in our clinic literally every single day. Swimming is low impact, so you can't get injured. It's an incredibly common misconception. And hey, while it's totally true that swimming removes that harsh, heavy impact of gravity hitting the pavement, the idea that it's entirely injury-free? Yeah, that's a complete myth. This one single sentence leads so many dedicated fitness enthusiasts to just push right through those early warning signs of joint and muscle discomfort, totally assuming it's just going to fade away on its own.
But here is the crucial point. The clinical reality is actually very different from the myth. At Westminster Multispecialty Clinic, our physiotherapists frequently see the real clinical consequences of repetitive stress. Think about it. Swimming is all about repetition, right? You are making the exact same motion thousands of times per session. When your technique is compromised or when you ignore the physical loads you're putting on your body, that repetitive stress just silently accumulates in your tendons and joints. So it's not really an impact injury, it's an accumulation injury. So to break this all down, here's what we're covering today. 1. The low impact myth. 2. Why injuries hide. 3. The big 4 injuries. 4. Root causes. And 5. The Westminster approach. Let's dive right in. Starting with section 1, the low impact exercise myth. There are some absolutely brilliant reasons why everyone is in the pool right now. I mean, it gives you a phenomenal full body workout without dealing with that oppressive heat. It's genuinely excellent for people who already have joint pain or are actively recovering from other impact injuries. And let's be honest, it is highly accessible. Dubai has absolutely no shortage of pools in residential buildings, hotels, and fitness clubs. But, and this is the vital takeaway here, swimming features its own highly specific injury profile. If you're doing it frequently and not paying attention to the details, well, those amazing benefits can get seriously interrupted.
Moving on to section 2. Why swimming injuries high?
Okay, so there is a massive difference between what we usually expect a sports injury to feel like versus what a swimming injury actually feels like in reality. Think about an acute sports injury. There is an obvious moment of onset, right? You twist an ankle, you take a nasty fall, maybe there's a sudden snap on the tennis court. You know exactly when and where it happened. But swimming injuries? Totally different story. There's no single incident. It's usually just a gradual ache in your shoulder after a long session, maybe a neck that feels uncomfortably stiff by Friday, or a knee that just begins to complain a little bit during breaststroke. It sneaks up on you. And because that pain builds so gently, and because swimming is widely considered this gentle sport, patients mistakenly just keep on training. They train right through those early warning signs, way longer than they ever would with, say, a gym strain. Our team's clinical observation on this is crystal clear. By the time the discomfort is actually significant enough to prompt a swimmer to rest, the underlying biomechanical issue is usually already well established in the tissue.
Which brings us to section 3, the most common swimming injuries.
Believe it or not, there is a very direct relationship between exactly how you swim and where you hurt. Based on our daily clinical observations, our physiotherapists literally map swimming strokes to specific injuries. For instance, with freestyle and butterfly, the shoulder is heavily targeted. This often shows up as tendon pain right at the front or side of the shoulder. Now, if you're a freestyle swimmer, your neck and cervical spine are super vulnerable to stiffness, especially if you have this excessive, one-sided head rotation when you go to breathe. Breaststroke, that places a really unique outward rotational force on the knee, which leads to inner knee pain. And finally, the heavy spinal extension and kind of wave-like undulation required in butterfly and breaststroke can easily trigger lower back pain, especially if you happen to lack core stability.
Now, I want to pause for a second and focus specifically on swimmer's shoulder. This is absolutely the most frequent injury we see at the clinic. It's basically an umbrella term for conditions affecting the structures around the shoulder joint due to repetitive overload and fatigue. Just think about freestyle for a second. It places a massive demand on the shoulder, requiring your rotator cuff to work so hard through thousands of repetitions. When those shoulder muscles get fatigued, the tendons that are supposed to stabilize the joint, they become totally overloaded. And if left unaddressed, this simple little ache can easily develop into a much more significant rotator cuff problem.
Let's look at section 4, what drives these injuries. So when we look across all these different injury types, a few really common factors pop up repeatedly in our consultation rooms. First up is a rapid increase in training volume. You know how it is, it's the start of summer, the pool looks super inviting, and suddenly you're swimming 3 times as much as you did back in May. That sudden spike is a huge driver. Combine that with poor technique, things like lifting your head to breathe instead of rotating properly with a body roll, and boom, you've a recipe for injury. Add in insufficient rest that literally stops your soft tissue from recovering, pre-existing muscle imbalances like a weak core, and that stubborn habit of training right through early discomfort. That specific combination is exactly what leads patients straight to our doors.
Finally, Section 5, the Westminster treatment approach. Our team's approach to fixing this is highly structured and grounded entirely in clinical reality. Step 1 is a full, comprehensive assessment. We don't just stare at the site of the pain. We look at your overall strength, your mobility, and your specific movement patterns. Step 2 is targeted treatment. If you have an overloaded rotator cuff tendon, we provide targeted therapy to actually support that tissue's recovery. But step 3, that is where the real magic happens. That's correcting the faulty movement pattern. Because look, if we merely mask the pain without actually fixing the biomechanics that produce the overload in the first place, we know for a fact the injury will inevitably return within weeks of you resuming your training. At Westminster Multispecialty Clinic, our clinical goal definitely isn't to keep you out of the water. We want to protect your swimming habit. For a lot of us in Dubai, it's pretty much the most sustainable form of exercise through these hotter months. We just want to ensure you maintain all those amazing cardiovascular and muscular benefits, accumulating fitness, rather than accumulating repetitive stress injuries. So, I'll leave you with this final thought to consider today. Are you swimming through an injury right now that could be easily fixed with the right movement correction tomorrow? Seriously, if you are dealing with a lingering shoulder ache, some neck stiffness, or knee pain that just won't clear up, please don't wait for it to become a chronic interruption. Seek an expert consultation with our team. We can identify exactly what's driving it, correct the mechanics, and get you back in the water totally pain-free. Thanks so much for joining me for this explainer. Stay safe and swim well.